Hey y'all, Dr. K here, connecting with you from the wonderful and beautiful Okanagan Valley in British Columbia. And I'm on vacation, but I had this idea and concept that I just wanted to throw down before I lost momentum. And it's simply this. We know healthcare is in trouble. I said this multiple times on our platform, long wait times in emergency rooms, no access to primary care, long wait times for emergency or for elective surgeries, and transformation is slow. And going through conventional channels, to me, I don't know if we have the patience for that right now. I don't have the patience for this right now. And so in the last few years, with a lot of the entrepreneurial stuff that I've been able to explore, these great minds that are involved in startups and so forth. To me, maybe this transformation starts from employers. Maybe it starts from insurance companies. Maybe it's these folks that are going to provide incentives for healthy living. Because I have no doubts, as you can imagine, prevention is the ticket. Prevention over prescription. Name of the show, the book we wrote, and this latest book we got, Opportunities in Healthcare. A this isn't like blatantly put in there, but this idea that if you're a company that is going to emphasize prevention, imagine this: you walk into the door and your employer says, "We are going to provide incentive for you to be physically active, provide you free gym membership. We are going to help guide you when it comes to your nutrition, provide opportunities for social connection, provide opportunities in management for stress, and emphasize your health. Prevention to the point where you're less likely to burn out, less likely to get exhausted. Like, I'd be all in on a company like that. I'd be all in on an insurance company like that. Because I think the opportunity is now, folks. People are ready for this. People are ready for people to see them, to see that I don't want to show up and emerge, or my parents to show up and emerge if I don't have to. If I could be the healthiest version of myself and have that, my employer being an ally and an advocate to support that. You know how validating that is? You know how proactive and forward thinking that is? I could promise you that it's going to pay back in dividends. The hustle's going to be there. The um the the hustle's going to be there. The return on investment is going to be there. The lack of burnout, the just the fact, like the loyalty of an employer just saying, like, you see me and you want me to prioritize my health. Yes, I'm all in. I'm all freaking in. And and the other component of this is, you leaders out there, this is what you should be embodying. This is something that uh, you should be the example of. Like, this is, I mean, I'm going to say I'm a super expert in leadership. I've been department head for 5 years, but this is how I want to show up. You show up as a leader, as I'm in good physical form. I'm eating well. I'm doing my best to manage my stress, being the example for those around me. So that motivates them. That's like the standard that we want to set for our group, so that we show up in our best form of ourselves. Because if you think about it, in my job, the stakes are freaking high, man. The stakes are high. Lives are at stake. So I want my nurses, physios, respiratory therapists, personal support workers, and our docs to show up being in the best form of themselves. So yeah, I show up like this, son, because it matters. It impacts outcomes. So yes, all this to say, this is a post I'm doing on vacay, folks, because I felt this passionately about this, is that we need, as employers, as leaders, to set the tone because I think this is where the change happens. We can't wait for government. We can't wait for like traditional system to make that change. Take the ownership and watch the change happen. And when it does, it's going to be freaking magical. That's Kate, and I'm out. Thanks so much for listening. Let me know what your thoughts are on this.